I will tell you 15 thyroid disease treatments in detail. 1. Levothyroxine. This is a synthetic form of the hormone thyroxine, T4, and is the most commonly prescribed treatment for an underactive thyroid. It is taken orally in the form of a pill and is used to replace the missing hormone in the body. 2. Liothyronine. This is a synthetic form of the hormone triiodothyronine, T3, and is sometimes used in combination with levothyroxine to treat an underactive thyroid. It is taken orally in the form of a pill and is used to replace the missing hormone in the body. 3. Radioactive iodine. This treatment involves taking a small amount of radioactive iodine in pill form, which is absorbed by the thyroid gland and destroys some of the gland cells. This treatment is used to treat an overactive thyroid, hyperthyroidism, and is usually effective in reducing or eliminating excess-thyroid hormone production. 4. Antithyroid medications. These medications, such as methimazole and propylthiouracil, work by inhibiting the production of thyroid hormones in the thyroid gland. They are used to treat an overactive thyroid, hyperthyroidism, and may be prescribed in combination with beta blocker symptoms. 5. Thyroid surgery. In some cases, surgery may be necessary to remove all or part of the thyroid gland. This may be recommended for people with large goiters, cancer, or other thyroid conditions that do not respond to other treatments. 6. Subclinical hypothyroidism treatment. Subclinical hypothyroidism is a mild form of an underactive thyroid that does not produce symptoms. Treatment for this condition may involve taking levothyroxine to replace the missing thyroid hormone. 7. Thyroid hormone replacement therapy. This treatment involves taking levothyroxine or another thyroid hormone replacement medication to replace the missing hormone in the body. It is used to treat an underactive thyroid, hypothyroidism, and may be recommended for people who have had their thyroid gland removed or who have certain types of thyroid cancer. 8. Thyroid nodule treatment. Treatment for thyroid nodules, which are abnormal growths in the thyroid gland, may involve observation, medication, or surgery, depending on the size and type of nodule. 9. Thyroid cancer treatment. Treatment for thyroid cancer may involve surgery to remove the thyroid gland, radioactive iodine therapy, and/or radiation therapy. 10. Goiter treatment. A goiter is an enlargement of the thyroid gland. Treatment for a goiter may involve taking thyroid hormone replacement medication, surgery to remove the goiter, or radioactive iodine therapy. 11. Graves' disease treatment. Graves' disease is an autoimmune disorder that causes an overactive thyroid. Treatment may involve taking antithyroid medications, radioactive iodine therapy, or thyroid surgery. 12. Hashimoto's thyroiditis treatment. Hashimoto's thyroiditis is an autoimmune disorder that causes an underactive thyroid. Treatment may involve taking thyroid hormone replacement medication to replace the missing hormone in the body. 13. Thyroiditis treatment. Thyroiditis is inflammation of the thyroid gland. Treatment may involve taking nonsteroidal anti-inflammatory drugs, NSAIDs, to reduce inflammation, or thyroid hormone replacement medication if the thyroid gland is not functioning properly. 14. Postpartum thyroiditis treatment. Postpartum thyroiditis is a type of thyroiditis that occurs after pregnancy. Treatment may involve taking thyroid hormone replacement medication if the thyroid gland is not functioning properly. 15. Hypothyroidism during pregnancy treatment. Treatment for an underactive thyroid, hypothyroidism, during pregnancy may involve taking thyroid hormones. Take care and see you in the next video. Subscribe channel and like the video. Thank you.